Hi, my name is Dr. Kelley Brummett, and I want to join you today and share with you some tips and techniques while utilizing a great product by DMG America called Luxacrown. I'm a general practicing dentist, restorative dentist. I'm also one of the lead visiting faculty down at the Pankey Institute in Key Biscayne, Florida. And we teach on form and function as well as anterior aesthetics in the Essentials 3 curriculum. So let's go through what I've learned about this product in my practice. You know, a lot of us, we get a phone call and we have a patient who maybe has an urgency or what some of us may call an emergency. And I want to help you understand that this material, as well as the techniques, can also be a way for you to help a patient move through treatment from an emergency into more comprehensive care dentistry. And so when I was in dental school, as well as all of you, most important to us was that we wanted to match the tooth, as well as we wanted to figure out how much reduction we needed for the material that we were using. Well, today there's so much more involved with prepping a tooth for a crown. And oftentimes we get these phone calls where a patient says, hey, I just need a crown. And these urgent crowns need to turn into conversations about the risks that are going on. And so I like these conversations to involve, okay, so what happened? What's going on? You know, did they get recurrent decay? Is there a periodontal issue that's going on with the patient? Is this crown a redo crown? Is it a brand new initial crown? And what's going on functionally? And these are all the questions that I have going through my mind as I discover that maybe someone has been put on my schedule. And so one of the examples that I want to share with you was a patient who called the practice and said, you know, hey, I just need a crown. I had gone to a dentist over the weekend. The crown had come off. They re-cemented it, but I want you to do the treatment. This patient had actually been a patient in the practice, but had not been in for some time. And so one of the things before I address this and think about what I'm going to do as well as what materials am I going to utilize, I want to know my patient. I want to know what is it about them that will help me take care of them, and what is it that I can help them understand about the situation they're experiencing, as well as, you know, what's going on with this tooth. That goes back to the risk factors that we just talked about. You know, what happened? Was it just random? Is something just unexpected? Or was it something that through time is leading up to the demise of this crown? And what I also want to know is with my patient and with the tooth is what do I know? What do I see? You know, and I would ask you as we're going through this, what do you see opposing this tooth? This is tooth number 14 above tooth 19, which is what the patient had called about. And I see some things. I see worn porcelain. I see buccal tip wear. I see recession. And I most likely am going to see some recurrent decay. And I want to think about how long has this restoration been there? You know, is this something that was placed 5 years ago, or is this something that's been there 15 plus years? And whenever I'm prepping the tooth, taking off the previous tooth structure, I want to look at the functionality that we discussed earlier. I want to know if he guides right, left, forward, and back, what kind of guidance does he have? Anterior guidance, group function? How is that affecting the crown and the future crown? How is it affecting the opposing crown that I identified may need to be addressed, or the buccal tip wear that I see on the premolars? If I see that there's anterior wear on that canine, which I do from this photo, I want to help the patient understand that there might be more. And this can help me move the patient from just that single tooth urgency to more comprehensive care dentistry. And the product that I love in the practice is Luxacrown. Just like Luxatemp, you know, it's easy to utilize. Luxacrown is aesthetic. I can use it. My assistants can use it. It polishes beautifully. But what I love about Luxacrown is that it has a little bit more durability. It's been proven to last in the mouth for 5 years. And what that can do is help slow our patient down. We can take the time to do a more comprehensive evaluation with our patients. We can help them buy time because sometimes we need to phase their treatment so they can financially support it. And I can oftentimes, all the things that I started theorizing about, his anterior guidance, the worn dentition, loosening of the crowns, the recession, I can protect the tooth, which is what he wanted, and I can evaluate what are the other things that I need in order to protect his teeth and the rest of his mouth for the long term. I want to move my patients from urgent, emergent care into more predictable care. Another example is a patient who she feared losing this anesthetic bridge more than she feared replacing it. She didn't know what was under there and she was afraid she was going to be toothless. With Lexicrown, I was able to gain her confidence so that way we could take the previous bridge off, we could prep the remaining tooth structure that we needed. I had to remove that tooth number 8. It was a root canal non-restorable tooth. And putting her into a more stable long-term provisional allowed us to evaluate things, go through caries control, go through periodontal control. We were able to do some Invisalign treatment to organize her occlusion so she had a better guidance and a better longevity to the future restoration. So Lexicrown is just one of those products that helps me slow the patient down. It helps me identify the risks that are going on with a patient. It helps me make diagnoses and then to create the treatments off those diagnoses for long-term care. I just find that if we don't speak about the things that we see when we have a patient come in who thinks they just have one problem, then they become resentments later on from our patients. I want to help a patient understand that oftentimes the mouth is working as a machine. It doesn't work as individual teeth. You have joints, muscles, and teeth that we want to work together. And Lexicrown is a great product. It gives us the gift of time. It gives us the gift of discovery. It gives us the time to evaluate the risks that we think are true, to test them out, and also help the patient understand how to manage those risks long term. Because we aren't perfect people, we aren't perfect patients, and just like a machine, we have to be maintained. So check out these materials at dmgconnect.com and get some more information about it. And they have amazing other products as well. Thank you very much. My name is Dr. Kelley Brummett, and my email is attached if you have any questions. And I hope to hear from you soon. Thank you.